On today's World Insight, India in the grips of a surging pandemic with China and other donor nations to the rescue. What's fueling the runaway infections and death? How are times ahead? And The Sixth, a documentary about 6 Chinese Titanic survivors. What can their experience of racism more than a century ago tell us about the plight of Asian Americans today?
That there were Chinese people on Titanic whose story was never told is important to tell it.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin in India, where COVID numbers have hit an all-time high with over 300,000 confirmed cases per day for more than a week. India's death toll already surged past 200,000. Last weekend, the country tallied a global record of over 400,000 cases in 24 hours, and its highest single-day death toll of nearly 3,700. The capital, New Delhi, was due to end a lockdown on Monday, but it was extended by a week. The influx of patients and medical supply shortages overwhelmed India's healthcare system. Authorities are working to ramp up vaccinations, as only 9% of the population have so far received one dose. Meanwhile, more than 40 countries have answered India's plea for aid. China sent some 26,000 oxygen ventilators and nearly 3,800 tons of medicines and supplies last month, and more will be delivered in May. But the question needs to be asked: what fueled the soaring COVID infections and deaths? How else can the international community help stem the pandemic surge? And what needs to be done in India and beyond? Let's ask our very strong panel. For the latest situation in India, let me go to Krishna Udayakumar, who is the director of the Duke Global Health Innovation Center. In Bombay, we have Sanjeeva Srivastava, professor from the Department of Bioscience and Bioengineering with the India Institute of Technology. In New York, we have Vincent Raccaniello, microbiology professor at Columbia University. Last but not least, in Nanjing, Wu Zhiwei, director from the Center for Public Health Research with the Medical School of Nanjing University. Welcome, gentlemen. We have a very strong panel. Now let me go to you, Mr. Srivastava. What is the latest? How devastating is the situation? What about people's access to vaccines and health facilities?
Yeah, situation is very grim right now, and this was a global pandemic to start with, but the second wave, which now we term as a tsunami in India, has really, brought down all the infrastructure and the medical facility to, huge limitations right now, because the testing facilities were, ramping up in the last phase. But right now, with the huge numbers of 400,000 or those kind of numbers rising every day, it's very difficult to reach out to all the rural parts of India and do the rigorous testing.
Yeah.
So that has been one of the major limitations. And given the high prevalence of these double mutants, which are now highly seen, at least in Maharashtra, we have seen at least 60% individuals are carrying the double mutants of B1617 variant, and likewise we have some UK variant was already there, B117. As a result, I think the testing has not been able to ramp up to the pace of the viral spread and the transmission, which is very rapid right now happening.
I see.
And by the time most of the individuals, they recognize their COVID-19 positive, I think it is already quite late, right? Because, I think, initial 2 or 3 days when they are infected, they are trying various things as a home remedy or some, the local medications, and just for fever and other things to subsidize. But very soon, once they realize that, they might be infected with, SARS-CoV-2, then they go for RT-PCR testing, and that is very limited now. In most of the small cities, they don't have those facilities, so they will send the sample to the closer, metro cities or to the some of the common places where, then they have huge queues of those samples to be being lined up. So then by the time you get report, you're already on the 4th or 5th or 6th day of infection.
Right.
And some of them are actually, having mortality issues even before they could do much work on that. So numbers are definitely, much larger than what is being shown. But just because that there is no, testing facilities to get those accurate numbers right now.
There are a lot of things going on all at the same time. Mr. Udayakumar, if I understand right, first of all, the crisis of those being infected in India, how they are going to be helped. Secondly, the overall situation of the spread of the virus and the scale of being infected, we do not know. Thirdly, we do not know whether vaccines could get access to India on time to deal with the issue. Fourthly, we do not know whether the neighborhood of India, for example, Nepal, have already seen over the past few days, 7 days, more than 1,400% increase of cases. What the neighborhood will have to experience. And fifthly, we do not know what it means for the rest of the world in the global fight of the pandemic. Tell me what we can know among this long list.
Yes, so what we do know is that a crisis in India is really a crisis for the whole world. We know that the pandemic and the virus doesn't know borders, so shutting down air travel is much too late. And as you pointed out, across South Asia, we're starting to see alarming rises in cases. What we know is that in India, there's been a failure of leadership to really both prepare for what was predicted to be a second wave, but also to take seriously and put in place real public health measures. We know that in addition to the variants that the government allowed large-scale gatherings to occur, which turned into super spreader events. And in the short term, we also know that vaccines are not going to be adequate to solve this crisis. It's much too late, and we don't have enough vaccines. So if you look at India, on sheer numbers, they vaccinated 159 million doses used in the country, which is the third best in the world. And yet, just given the size of the population, we know that less than 10% of the population has received even the first dose of vaccine. And domestic manufacturing rates are about 70 to 80 million doses a month, which is substantial, but relative to the population, significantly inadequate to meet local and urgent needs. So we have to find solutions, which really include global assistance. We have to be able to temporize the situation using public health measures. And in the long term, we absolutely have to ramp up availability of vaccines.
What do we know, Professor Wu, from your perspective?
The point is that the overall vaccination rates are very low in India. In most of the cities, actually, they are below 5%. And in some of the areas, basically none of the vaccination were carried on. And the highest is in West Tripura and Northern Tripura, which actually reached about 10%. In other major cities like Mumbai, it's approximately 6 to 7%. So overall, it's very low. The other thing is that we all know that this is basically a combination of a number of issues like the elections and religious celebrations, and also people's general attitude in terms of they are kind of overconfident in terms of when they saw the first wave came down and people thought, okay, it's all right, the pandemic is gone. So that's one of the those are the issues contribute to the upsurge of this second wave.
China is bordering India, we all know that. And also the South Asia, many of the countries are also China's neighbors. So China has been this, with the early prevention and control doing relatively fine so far. How will China look at India right now and also be able to support for the fight, the difficult fight going on within India?
The Chinese government has offered the willingness of providing help and medical facilities and medical supplies. I think this is a very friendly gesture in dealing with this global issue. I think China has a lot of experience in dealing with the early outbreak of this of this pandemic. I think a number of issues actually, or the experience. I think India could look at it is that by doing limited shutdown and also establish national network of testing diagnostic centers and also expanding their medical facilities, such as setting up the temporary hospitals.
I know that some of the measures have already been adopted by India, right, Mr. Srivastava?
Again, there has been good effort to create some temporary hospitals,
Yes.
and even in other specialty center also they have added more beds for COVID treatment. But given the magnitude of the population, I think all those efforts in a limited time has been quite minimal to really cope up to this particular pandemic.
Understand.
And I think just if I go back to one of the question being addressed by Dr. Uday Kumar regarding the vaccines, right? So even this pandemic has really made a good setback for the Indian vaccination program, because many people are even hesitant to go out even for taking vaccine, because you go to a center and you never know that you might even contract infection that time. And also the efficacy of these vaccines will be tested over the time only, because right now there is very limited data to say that these mutant forms which are in the spike protein, can they really control this particular mutant, and how best the Covishield is going to control that, or Covaxin, which is more of the indigenous India make of the vaccine, how best they're going to work against these mutant forms. There are very limited studies to say. The time has been very short and things have really rapidly progressed.
I see.
Much beyond the scientific infrastructure and what we could have done in that given time.
Yeah. Professor Recagnalo, how do you look at India's situation right now? Is it really going to, go to the stage of herd immunity given the, the speed of spreading and the lack of solutions on such a scale of devastation so far?
Well, a few months ago, people were asking me, why doesn't India have very much COVID? And we didn't have answers, but I think one of the answers was there was COVID, but it wasn't being detected. And it rose to the level where now it's an explosion. You asked me if we're going to get to herd immunity. Well, getting to herd immunity by natural infection is devastating,
very devastating,
because
yeah.
a lot of people will die.
Yeah.
You'd rather reach herd immunity by vaccination.
Of course.
We reached herd immunity in 1918 influenza pandemic after 5 years of devastation only without any vaccine. So it's a very difficult situation and really requires the help of all of the world, because there are a lot of countries that can help. They have the expertise to go in there. You have to look at it as wartime and use the same approach.
It is wartime, isn't it? Looking at the scale. Pandemic is very different from the war. You cannot ask human beings to do things to immediately have a ceasefire. So, Professor Recagnalo, on that, what do you think could be the immediate solution?
Yes, we can't ask the virus to cease fire, can
No,
we?
you
It would
can't.
be good if we could. There is no immediate solution. That's the unfortunate part of this. There are so many people. It's impossible, for example, to physically distance
Yes.
in many parts of India, as you know. But some of the things that can be done have been mentioned. I mean, we can build hospitals to put people in. We did that in West Africa during the Ebola virus outbreak. Much smaller, of course, but many nations mobilized and helped. So that's what has to be done. But it's not going to be over in a month. This is going to take a long time.
So, Mr. Udayakumar, we understand some of the pharmaceutical companies are likely to provide more vaccines to India. It's likely only to be delivered from now until later next year. So it's not going to solve the problem right now. Will vaccine really be the solution before we see the very tragic herd immunity as we talked about, unfortunately, unwilling to talk about?
Right. I think vaccinations in the long term are most definitely a major part of the solution, but we can't rely just on vaccines to get us to herd immunity or get us past the acute phase of this pandemic. So around the world, we've now reached more than 1.1 billion doses of vaccine that have been delivered, but it's been delivered in a very inequitable way. Most of the short-term supply has been locked up by high-income countries. And outside of high-income countries, it's really been India and China as the major manufacturers of vaccines that have made them available domestically and to other low and middle-income countries. So in addition to what's being manufactured in India right now, there's no major supply that's available to import to India. We've in fact been checking with some of the major manufacturers, and there's no supply just waiting to be shipped. There's no supply that could be diverted right now. Everybody in the world is looking for more doses of vaccines. So that's just unfortunately simply not possible. We do expect the amount of vaccines available to be significantly higher into the second half of this year and into next year. So we are talking about months to years before most low and middle income countries, including India, have enough vaccines to be able to cover significant portions of their populations, which brings us back to everything else that's required in terms of distancing, potential lockdowns in the short term, significant uptick in testing. All of the public health measures we know have to be in place because we can't just wait for vaccines.
No, we can't. You have to do what you have to do, right? There are a list of things that you have to do and have to do it together, all at the same time, enforcing them. Mr. Srivastava, do you see that is likely to happen in India? All of the above-mentioned suggestions raised by the other three gentlemen, and you also yourself talk about some of those. Are they likely to be enforced?
Right. So I think things are already being implemented. For instance, many states, including Maharashtra, is currently under lockdown, and those have at least tried to control it, at some level. There has been several efforts by the government and other NGOs to build some temporary centers for more treatment. But, I think the ramping up the entire testing facilities, as well as providing medication to people on time, these are really huge challenges, given a lot of limitations we have. And what we are essentially seeing is the metro cities of India. But what is the major problem is also the smaller cities, where there is a lot of unavailability of medications and a lot of other testing facilities. So we have to also look into those and see like how best we can spread these resources to the almost all parts of India, not restricted to certain places. So, given the short time where we have seen such a huge surge, I think it definitely exposed the lack of, preparedness towards handling such kind of situation. But hopefully with some of these lockdown in different states, probably governments are getting some time to control that.
Okay.
I'm not sure how best one could really handle the situation. Lockdown countrywide was one of the ways out last year. But given the economical situation, I think that is also may not be the best feasible way again. But people are migrating, people are moving from one to other place. So unless we have a complete shutdown for some time, it is really difficult to control, because the mutants are already many available and it is spreading very rapidly.
Yes, I understand. The situation on the ground is very complicated. Professor Raccaniello, we see the virus getting ever more complicated. For example, reflected in the UK version, the South Africa version, and also some of Brazil version. And now we have further complexity coming from India. So what does that mean for the global fight against the pandemic?
I am less worried about the viral variants than human behavior. We've seen over and over again, for example, here in the US in Michigan, had a huge spike because students decided the pandemic was over and they wanted to get back together again. And the press is very happy to blame variants, but I'm not so sure that that's always the case. This virus is doing what viruses do. As it moves through populations, it changes. And what the significance of those changes are, many people have speculated. But in my view, there are no data really to clearly support increased transmissibility. There's not even data to support increased virulence. I think we have to view this as SARS-CoV-2. In many cases, the vaccines do work against multiple variants, especially against hospitalization and death. And so I don't think it's productive to blame the variants. I think we have to get people to listen to us and realize that the pandemic is not over, and they have to do the isolation and so forth that's required of them.
We certainly have to keep an eye on what's happening with the variants, but to date, we don't have any real data from India that the variants that are being experienced there are somehow not susceptible to immunity through the vaccines that we currently have available. I think it's much more that we've seen this build up over weeks to months of allowing this second wave to develop with such force that it's going to take weeks to months to get us out of it.
We have seen a lot of examples over the world in some countries that when people feel that the pandemic is going down and people are actually trying to get together, and you see the virus surge again. This is not only one or two cases, basically all over the world, from Europe to Brazil and now India. I think this is something actually politicians, government do need to have a very strong political will to implement the public health approach to deal with the virus, to see that the virus is completely under control before you loosen up the society and open up the society. I think it's something we have to bear the pain.
The IPR issue of the vaccine is a big one. Who will have the IPR? Certainly, we're going to make a huge fortune. Legally, of course, that is they're entitled. But at the same time, with the pandemic and spreading of it so fast, losing so much life, what's likely to be this discussion of the IPR for the vaccines?
We should do everything possible to ramp up manufacturing of effective and safe vaccines around the world. What we have seen is that our existing capacity wasn't enough to deal with a pandemic, but it was also extremely consolidated. So the Serum Institute of India was the world's largest vaccine manufacturer, and the doses being manufactured there being used predominantly now domestically in India means that COVAX, for example, doesn't have access to the majority of vaccine doses it was counting on. So the 92 poorest countries in the world are also without vaccine because of what's happening in different parts of the world. IP rights are a component of what we need to deal with, but our analysis would say that it's not actually patent waivers that are standing in the way of vaccine manufacturing ramping up. If you take a look, it's really the fact that we've got bottlenecks across the supply chain. You need patents for sure, but you also need know-how, you need the capacity, you need human capital. And so the bottlenecks often are not the bulk drug manufacturing or the fill and finish capabilities, but rather access to supplies like reactor bags, access to lipid nanoparticles for the mRNA vaccines. So what we think is needed is really a much more comprehensive approach that has as its end goal developing and making sustainable vaccine manufacturing capacity. But I don't think just creating patent waivers is going to be enough or is the right answer.
Best wishes to India to be able to control it within as short period of time as possible with all the other support. Thank you so much, gentlemen, for all of your support in this discussion. Really appreciate it. Mr. Udayakuma, Mr. Srivastava, Mr. Recaniello, and Mr. Wu. Thank you.